My name is Eraj Basseri. I'm the director of the Center for Hyperhidrosis. The goal of the center is to educate everyone who has hyperhidrosis in the right direction, for them to be well informed to make the right decision as to how they should be treated. Hyperhidrosis is defined as excessive sweating. It affects about 1.5% to 2% of the US population. Patients can have it in multiple forms. They can have generalized, they can have focal. Within focal hyperhidrosis, some patients have facial sweating, some have just underarm sweating, and then there's a subset of patients that we treat who have the hands, the feet, plus or minus the underarms. This is the only group that we treat with surgery, and this is the only group that we can cure with surgery without causing another problem. It's a very emotional condition. Most patients are told, don't worry about it, just relax, it'll go away. Why are you making such a big deal of this? And that's not the case. They can't control it. This is, for majority of patients, a genetic condition. And they didn't do anything to get it. It has nothing to do with their ethnicity or where they live or what they eat or anxiety. This is solely a genetic condition for most of our patients, and they can't do anything to stop it. So there are some patients who fall outside of the usual clinical presentation, but for the most part, if someone has the 3 criteria I mentioned, then the surgery is a 100% cure. And it's instant. Surgery takes about 30 to 45 minutes. Once they're done, they're in the recovery room. As they're waking up, I put their hands together and their hands are warm and dry compared to being usually cold and wet. I've been lucky enough to train with Dr. Reisfeld, who is the master of this operation. The center and I have done over 8,000 surgeries. I personally, since 2003, have done over 4,000 sympathectomies, which is insane because it's that many patient relationships, it's that many families, and it's that many lives changed. This is a cure, and I think that's what a lot of patients have a very difficult time believing, but it's real. This issue of excessive sweating, of dripping hands and dripping feet, and the emotional roller coaster that puts them through will be gone.